Our next speaker is Dr. Vandana Palve, who will speak on effect of Rason, allium sativa, siddha, ksheera, Basti on osteopenia and osteoporosis. Dr. Palve.
Respected dais and delegates, I would like to present my study topic, efficacy of Rason, siddha, ksheera, Basti on osteopenia and osteoporosis. I was done this study under the guidance of Vaidya Pramod Kulkarni. Osteoporosis is a condition characterized by a decrease in the density of bone, decreasing its strength and resulting in fragile bones. Osteopenia is a condition of bone that is slightly less dense than normal bone but not to the degree of in the osteoporosis. DEXA scan gives the values of bone matrix in T-score. WHO defines osteoporosis and osteopenia on the basis of T-score values. Osteo means bones, means asthi, and porous means saushirya. Hence, osteopenia and osteoporosis correlated with asthi saushirya in this study. There is no sufficient information about asthi saushirya in Ayurvedic classics, but in Ashtang Sangraha and Ashtang Hriday, it is described as a symptom of asthi marjagata vat. Hence, in this study, osteopenia and osteoporosis are taken as a symptom of asthi marjagata vata. Basti, in the treatment of asthi marjagata vata, Charakacharya described internal and external oleation. Basti is medicated enema is one of the internal oleation therapy. Rason, siddha, ksheera is advised as a oral medicine in vata vyadhi treatment. Rason is the drug which have pungent, bitter and madhura ras, wins vata, rasayana and has the property to reach up to asthi and majja dhatu. Hence, Rason, siddha, ksheera, Basti was selected to study its efficacy on osteopenia and osteoporosis. The aim of the study is to study the efficacy of Rason, siddha, ksheera, Basti in osteopenia and osteoporosis, and objectives are to study the effect of Rason, siddha, ksheera, Basti on osteopenia and osteoporosis in terms of DEXA scan T-score values. And second objective is to study the effect of Rason, siddha, ksheera, Basti on the symptoms of asthi marjagata vata. Rason, cow milk, cow ghee, til oil, honey, lavana, enema pot, simple rubber catheter, vessel stirrer are the materials required for this study. It is an open label, single arm, single center, randomized clinical study. 42 subjects were enrolled satisfying inclusion and exclusion criteria in the study. This is the study flow chart. Collection of data, a clinical survey of patients attending the OPD and IPD of hospital were made, and patients fulfilling the criteria of diagnosis as per the proforma were selected for the study. A clinical evaluation of patients were done by collection of data through information obtained by history, physical examination and laboratory investigations including X-ray and DEXA scan. All patients were assessed by symptom assessment score. The drug material required for the clinical study were procured and Basti drug was prepared in the Panchakarma department of hospital as per SOP. The data which are obtained by the clinical trial were statistically analyzed by applying student parity test. Inclusion criteria, age between 30 to 70 years irrespective of gender and religion, willing to sign informed consent form, bone densitometer showing T values less than -2.5, bone densitometer showing T values between -1 to -2.5, showing maximum signs and symptoms of asthi marjagata vata. Basti arha asthapya means person suitable for decoction enema. History of recurrent fractures. Patients of childbearing age willing to use contraceptive measures during the study. Exclusion criteria, patients not willing to sign informed consent form. Basti anarha anasthapya means patients not suitable for decoction enema. Presence of any other serious disease and patients on HRT. Parameters of the study, objective parameters are hemogram, serum calcium, DEXA scan and X-ray hip joint, and subjective parameters are asthishul, sakthishul, sandhishul, balakshaya, aswapnam and santataruja. Formulation of Basti, 35 gram of Rason with 280 ml cow milk, 120 ml tap water was taken to prepare Rason siddha ksheera paka. Then 80 gram of honey, 5 gram of senda, 60 gram of cow ghee and 60 ml tilatel was taken to prepare Rason siddha ksheera Basti. All standardized and identified samples were used. Basti Dravya was prepared as per standard operating procedures. Dose and administration of Basti, Rason siddha ksheera Basti was given up to in the dose up to 480 ml depending on individual's retention time, duration for 15 days per rectum after having light breakfast. Basti administration was also done according to SOP. Properties of Rason siddha ksheera Basti, it is madhura dikta rasatmak katu rasatmak ushnavirya and madhura vipaki. It's having properties snigdha, pichila, tikta, ushna, tikshna, sukshma shrotogami, bruhana and drishya. It is vatashamak, rasayana, asidhatu, poshaka, bruhana and stairyakara. Charkacharya describes that the combination of ksheera and ghruta are the best rasayan dravyas. Analysis of Rason siddha ksheera Basti was also done. This analysis shows that Rason siddha ksheera Basti, that is after the preparation of raw milk, when Basti Dravya made, that potassium, calcium, magnesium, zinc values gets increased by approximately 6 times than in raw milk. Observations and results: 42 patients were enrolled in the study. 12 patients did not complete the treatment, hence they considered as dropouts. 30 patients completed the treatment. The data collected from this showed that 16 patients were from age group 41 to 60. 21 patients were female, 17 patients were taking mixed diet, 19 patients were having irregular dietary habits, and 11 patients were of Vatapradhan Pittanubandhi Prakriti. Statistical assessment of objective parameters concluding calculated T and P value. This is statistical assessment of subjective parameter. Effect of therapy: 56.67% patients showed normal T score and 43.33% patients showed improvement in their T score. T values increased after completion of duration of treatment, which was statistically significant. 76.51% relief was found in the pain after treatment, which was statistically significant. In the present study, all patients got 50% relief in Balakshaya. According to Sushrutacharya, a properly given Basti remains in Pakvasha, Shroni and below Nabhi, and through the Shrotasas, the virya of Basti Dravya spread to the entire body. Basti is having two actions: expelling morbid doshas and nourishing the body. Basti Dravya metabolizes in Pakvasha with the help of Shoshamana Vandhi and then get absorbed. The active principle of drug used in Basti get absorbed in systemic circulation. Absorption through the gastrointestinal mucosa occurs by active transport and by diffusion. Due to Madhura Rasa of Rason siddha ksheera Basti, it becomes Parthiv Mahabhuta dominance and act as Vatashamaka, Asidhatu Bruhana, Poshana, Stairyakara, Vrushya, in turn Shula Shamana. Tikta with Katu Ras has quality of Astigamitva, that is, it reaches up to Astidhatu as it is of Akasha and Vayu Mahabhuta dominance. So, by action of Ras, we say that this Basti acts on Astidhatu and Majjadhatu. Due to Snigdha, Pichila, Bruhana properties, it replenishes Majjadhatu. Tiktaras absorb clay the armor. This channelizes movement of Vata by pacifying Margavrodhajanna pathogenesis. Rason can relieve Dhatu Ksharanya as well as Margavrodhajanya Shula when given in form of Ksheera Basti. From this we can say that this Basti Dravya gets absorbed by Asidhatu and then results in changing in bone mineral density. Conclusion: Rason siddha ksheera Basti helps in restoring bone mineral density. P value is less than 0.05, statistically significant at 5% level of significance. Rason siddha ksheera Basti also showed good results in Asthi Majjagata Vata. Thank you.
Well done.